thank you. Well, good afternoon. Nice warm afternoon we have today here in Salt Lake City. This is a real pleasure for me. Here in Salt Lake City government, we realize the responsibility of intelligent planning, both to our residents, to our taxpayers, and to our employees. We have worked to promote the health and wellness of our employees and to lower their healthcare costs. For me, this idea came from a visit I was having with other mayors, and one afternoon I was sitting next to the mayor from Chattanooga. And as we were comparing notes, which is what we do as mayors, like any of us in our peer groups, and I said, what was the best thing you have done as mayor? He was in his third term, in the time you've been mayor of Chattanooga. And he said, 4 years ago, we started a health clinic for our employees. And he said it was a bit controversial when we got it started. He said, it has been the best thing for our employees, for healthcare costs, and of course, ultimately for our city residents and taxpayers. And that prompted me to contact our great folks in human resources, Deb Alexander and Jody Langford particularly. And it turned out we had a health clinic at one time in our past. And they really over the next couple of years, I think it's been a couple of years, have looked at both the feasibility, the desirability, and how we can best establish a health clinic as we came to a conclusion of the benefits of it. That would really serve our city best and take best advantage of our city resources. And today, we of course are at the culmination of that great work by our city folks to establish this health clinic that we're opening today. In the course of the work that Jody and Deb and others did, they talked to our healthcare provider, our health insurance provider, PEHP, and together with them, as a partnership, we're opening the Midtown Clinic today. This clinic is employing Dr. Trevor Jacobson, a primary care physician who will focus on disease management and preventive care as well as wellness. Our city employees and their covered family members will experience ample time with Dr. Jacobson, who will help them determine if lifestyle changes are needed to enhance their health and their well-being. Before we officially open this Midtown Clinic with their ribbon cutting, there are others who I would certainly appreciate speaking today. So in order, we'll be hearing from Dr. Donna Milovitz, who's the CEO of On-Site Care Clinics, Dr. Trevor Jacobson, who I mentioned, Family Medicine, the Deputy Chief of Police, Lee Dombrowski, and our Salt Lake City Council member, Carlton Christensen, who's been involved with us as we've been exploring and getting us to this point. So, Dr. Milovitz, please.
Good afternoon, Mayor Becker, Councilman Christensen, and esteemed ladies and gentlemen. My name is Dr. Donna Milovitz, and I'm the founder and CEO of On-Site Care, a woman-owned small business here in Utah. On-Site Care is a primary care provider for employer groups, and we are delighted to be working with the city as well as PEHP to implement and manage the Midtown Employee Clinic. I started On-Site Care in 2007 to change the delivery of primary care for employer groups, and we have 9 operational workplace clinics along the Wasatch Front, from Provo to Ogden. As a primary care physician, I was frustrated with the inability to engage with my patients in a manner that would improve their long-term health in the current fee-for-service model. I didn't know who my patients were. I didn't have enough time to spend with them to meet their needs during our clinic visits, and there was no accountability from my patient side and also my side for reaching out to them for follow-up. On-Site Care's mission is to bring primary care to the workplace, to make it easy to access that care, to make it affordable, and to hold our physicians, myself included, accountable for working together with our patients to improve the long-term health, which lowers the overall cost of health care. We do not operate in a fee-for-service model where the more a physician does, the more he or she gets paid. Our physicians are salaried at a competitive working wage without incentive pay because the incentive pay structure calls into question what is best for the patient versus what is best for reimbursed for the provider. As an example, not all headaches need a head CT as an initial evaluation for that patient. An excellent history and physical examination, which takes time, is what that patient needs and can diagnose about 90% of all clinical issues that arise in a workplace clinic. Additionally, all revenue that is generated in the clinic goes back to the City of Salt Lake to offset the cost of the clinics. The more the employees and their dependents use the clinic, the more the city saves. We come to employers with proven solutions to stabilize the cost of healthcare. Our clinic visits are longer. We work with PEHP as a claims processor to share information both to the clinic and from the clinic to better care for our patients, and we bring personalized healthcare to work. Thank you for the privilege of being able to share and care for your valued members of your workforce and your families. As a resident of the City of Salt Lake, your healthy workforce helps keep my family safe and healthy. Thank you.
Thanks, Dr. Milovitz. Thanks, Mayor Becker. Thank you, representatives from PEHP in Salt Lake City. What a privilege it is to be here today for this event. I've been asked to speak briefly about my views and philosophy regarding healthcare and some of the health benefits that we'll have here at the Midtown Clinic. I'm proud to say that my views on healthcare are deeply rooted in my country childhood. I grew up in a small community where I had a small town doctor. He knew me personally. He knew my family. Throughout the years, he grew to know my medical history, and he used all of that to help provide excellent care, primarily focused on prevention. If diseases did occur, he used treatments such as lifestyle adjustments. He educated about disease process, and he encouraged me to participate in my own health care. Using that, I saw what a difference he had on the community and the impact that he had in a positive way. It was that difference that he made that inspired me to pursue a job in family medicine. And also, not only that, to work in a clinic similar to his. I was fortunate enough to get accepted into the University of Utah School of Medicine, and I stuck around Salt Lake for my residency training at the University of Utah Family and Preventative Medicine Residency Department. After years of education and training here in Salt Lake City, I'm proud to say Salt Lake has become my home. When it came time to find for a job, I looked right here in my community first. Sometime during my training, I realized healthcare today isn't what I had perceived it years before. It seems like now, more than ever, healthcare is generally more focused on generating more profits, increasing profits, and less on healthcare itself. That all changed when I met Dr. Milovitz, and now thanks to Salt Lake City and PEHP, we have the Midtown Clinic. This clinic is an out-of-the-box solution to switch the focus from costs back to healthcare. Its focus will be primarily preventative. When treatment is needed, we will use lifestyle adjustments, educate the patients about their disease, and through programs and initiatives, we've been able to, the patient will be able to take their own healthcare into their own personal lives and be able to make differences themselves, all the while making the care affordable and accessible. Additionally, for those services that we cannot provide here in the clinic, we are committed to finding the best quality care at the lowest cost using tools and services provided by PEHP. I see this clinic providing all of the same benefits that I got out of my small town clinic, and what a privilege it is for me to be your small town doctor. I'm excited to get started, and I'm proud to be a part of this. Thank you.
What does a police officer know about a medical clinic? The answer for the most part is nothing. But the reason I'm up here is because in Salt Lake City, I have had the privilege for 10 years to be on the city's benefits committee. The mayor, the council, they allow us as employees of the city to help decide our future in medical care. One of the things that we've had the opportunity to do is use or implement a high deductible health plan, which sounds scary when you just use the term. But what it has made us is better healthcare consumers, and we as peers have had the ability to educate our peers on how to be better healthcare consumers. And with that, we have this opportunity today that I'm excited to roll out to my peers of another piece of the puzzle of maintaining costs, not just for the employee, but also for the taxpayer. Because the money, the profit from this will be reinvested in the city, saving the employees, saving the taxpayers. I think it's a win-win. And when it comes to doctors, once you get one you trust, you don't want to keep going to someone else and someone else. Now we as employees have our own small town doctor, great term which I'll use as I talk to them. But the commitment that the council and the mayor have made to us to contain costs for the well-being of the employees is something that is commendable, and we say thank you.
Our thanks to PEHP for being a great partner here. The public expects the public sector to look for partnerships in addressing the rising costs of healthcare. A few years ago, as we evaluated our own self-funded insurance plan and were faced with some challenging actuarial balances, it was clear that we couldn't continue on the direction that we were going. And through some changes and some partnerships, frankly, with employees, we've been able to bring our cost in line and frankly, in return, better insure the employees and looking toward truly catastrophic coverage. This is one more step in that partnership, and I think that we'll find some exciting outcomes as a result of this. I know in going through the process myself and being a partner in my own health care coverage, I probably eliminated $2,000 of cost annually in looking at how I secured health care. A noted professor who I will claim as family connection, Dr. Clayton Christensen from the Harvard Business School, has written extensively on health care, and one of the things that they found in his own research is that helping people to access care at a lower level and taking control of how they access care will ultimately be one of the key factors in controlling and bringing health care costs down to a level that we can afford, because if we stay on the current trajectory, many people will find themselves in very challenging situations. So our thanks to the partners that are here today, and we look forward to a very successful outcome in this venture together.
Okay, thank you. We're going to have the ribbon cutting. I want to I know that there have been a lot of people who have been directly involved. I'm going to particularly single out Jody Langford and Deb Alexander, if you could raise your hands. And those of you, the rest of you, on the benefits committee, if you'll raise your hands, we just want to acknowledge you with a round of applause because you've done enormous and wonderful work. So let's get on with the ribbon cutting here. There are no repellers coming down today, but we still will still appreciate being able to open this clinic. And you know, there are a few things that I can tell you as we're getting set up here that I can tell you that that I get to work on, where we have not only a good feeling about the outcome, obviously of providing better healthcare services for our employees and reduce costs. But we can really help show ourselves and our community how we can model the best for a very troublesome arena in healthcare. And I think this healthcare clinic with the high deductible plan that's been mentioned are two ways that we have seen in a remarkably short period of time, the healthcare costs and the health services that we provide in the city for our employees have done literally a turnaround, a complete turnaround from costs escalating every year to now costs going down. And that's hard to imagine in this environment when it comes to healthcare, and we're looking forward to this clinic obviously providing a very significant step forward in both of those ways. So let's get on with our ribbon cutting. Sure, there we go. So just remember, now you have your hands, let's get everybody's hands on here. Ready? All right.